And today I will deal with heparin therapy. What is the action of heparin? Heparin is an anticoagulant agent or drug, which means this will prevent blood clot or clotting or coagulation inside our blood vessels. Now, which are the conditions we are using this heparin therapy for a patient? Cardiac conditions, then lung condition or respiratory conditions, then blood vessel diseases. For example, DVT or deep vein thrombosis, cardiac condition like atrial fibrillation, and pulmonary embolism like respiratory conditions. Okay. Now, coming to nurse's responsibility while giving care to a patient with heparin therapy. It's very important question and very frequently asking question for all nursing exams, including AQN. Okay. So here, the first, as a nurse, your responsibility is to closely monitor your patient for any signs or symptoms of hemorrhage. Why we need to monitor your patient for hemorrhage? Why? Because of the action of heparin, there will not be any coagulation, right? So this may cause to hemorrhage or bleeding, especially bleeding through nostrils or nasal bleeding, then bleeds from gum, then internal or any part of the patient's body. Okay, so closely monitor for that. And second responsibility is monitor your patient for hypotension. Why? Because when you are monitoring vital signs including this blood pressure, when there is severe pains, that may be indicating with severe blood loss or bleeding. Okay, and monitor your patient for any signs of anemia or maybe patient complaining regarding this severe fatigue. These all may contribute to bleeding. Okay, so closely monitor your patient. And next one is monitor for tarry stool or dark stool. Why? Because dark stool may indicate with internal hemorrhage. Okay, so monitor for that. And next point is instruct your patient to use soft toothbrush, or maybe patient is using any hard materials, means this may cause irritation to gums and definitely cause for gum bleeding. Okay, so in order to prevent that, instruct your patient to use a soft toothbrush. Okay, then now coming to the dietary education. Then as a part of this heparin therapy, patient will have another complication as hyperkalemia. Hyperkalemia means what? Increased potassium level. Okay, when there is hyperkalemia will occurs, means this may create cardiac complications. So in order to prevent that, instead to avoid with containing fruits, vegetables or potassium supplements, etc. Okay, now coming to heparin overdose. So as a part of this therapy, you assess heparin overdose. What you will do? Definitely we want to treat our patient with an antidote. So what is antidote for this heparin is protamine sulfate. Okay, so treat your patient with protamine sulfate. Okay, then now coming to what are the applications we are expecting. First one is, of course, severe hemorrhage. Okay, second one is thrombocytopenia. Third one is osteopenia, and another complication I already mentioned is hyperkalemia. That also will cause for cardiac complications. Okay, so today I explained with heparin therapy. I hope you got some points from my video. Today this much. Thank you so much for watching my video and see you in another video session.